heard about this activity-based working, I couldn't conceptualise how this was going to work. I thought, it's a bit random, it's a bit out there, didn't really understand, but now that we're down here, I love it.
Activity-based working is changing the way people work.
Unprecedented investment is occurring at Blacktown and Westmead hospitals. This investment will increase the capacity of these two large hospitals. We're making changes to the design of clinical services, but we've also made changes to the design of the places in which people work. We went ahead and created the first activity-based working hubs in public health services in Australia.
It's a little bit like being in your home. You have your kitchen for cooking and your lounge room for relaxing and your bedroom for sleeping. The activity-based working space is very similar to that.
The space is divided up very clearly into different areas of activity. The etiquette's really clear and everybody understands the different spaces and how they work.
There are spaces where you can rely upon being left quietly to your own devices. You just have to indicate that by going to those spaces and choosing where you work. I go to an outpatient clinic and I use a room for the morning, and then I go to the wards and I do my work wherever it needs to be done, and I don't expect to own that space. So this is an extension of the same concept.
Our roles really lend itself to working in these kind of spaces. I would suggest that most clinicians are doing many different kinds of activities in their day-to-day work life, and that goes all the way from interns to registrars all the way through to senior clinicians. All I need is a secure space to put my things for a few hours or for the day, and if lockers are available, then I don't really need any other storage space.
The hub was really designed with the workers in mind, and the workers collaborated with the architects to make a space that was really useful for us.
I'm finding meetings are run much more smoothly and more timely because of the technology we have in the hub. I was nervous initially about letting go of my office, but it's actually been quite liberating to be able to do work wherever you are.
I find that the interaction that I have with other people in the hub is the big advantage. There's a lot of casual sort of conversation and interaction that solves problems quickly that never used to happen before when everyone was inside their little space.
It's been a really great experience so far. I think it's definitely increased staff morale, and it's made us feel more inclusive.
And all this is just the beginning. Contact us today to find out how we're designing our future and making work more flexible, supportive and satisfying.